All right. Hi, everybody. So, for those of you who don't know me, I'm Carl Bonnet. I am the founder and medical director of Clarasana. And today I am joined by Dr. Zackary Tedder PsyD, psychologist of Meet Your Mind ATX. And Zach and I have been working together for what's it been, 8 years now, Zach?
8 years.
8
Can
years.
you believe it?
So, yeah, so Zach is super experienced in the ketamine space, was a therapist prior to getting his PsyD. We worked together in our Austin clinic doing a lot of ketamine-assisted psychotherapy. He has seen a ton of patients and actually did his dissertation on ketamine-assisted psychotherapy at Capella University. So welcome, Zach. It's good
Thank
to
you
see
so
you.
much for having me, Carl. I really appreciate it. And anytime I get to talk about ketamine, I'm really excited. So
Exactly. Oh man, yeah, it's great to see you, man. So here,
yeah.
so what I want to talk about, obviously Matthew Perry's got a lot of press, right? And my fear is that, as you and I know, ketamine and other psychedelics have the ability to revolutionize mental health care. This whole idea of changing one's mental perspective and paradigm, whatever. And of course, the first study came out on ketamine in 2000. So I mean, we've got like 24, almost 25 years of studies on ketamine, and the sensationalism now of Matthew Perry and people jumping all over this and just saying, oh, ketamine this, ketamine that, has me concerned. And one specific topic that I want to talk to you about today is, in his autobiography, he talked about the death of the ego. All right, so he talked about how, I'll read his quote off my other screen here, as the music played, the K ran through me, it became all about the ego and the death of the ego. Now, my concern is that people are going to misunderstand that and misinterpret that. In my clinical experience, I know in talking to you, ego disruption, this concept of leveraging the disruption of the ego can be very beneficial. But my fear is two things. One, that he doesn't have the same definition of ego disruption that you and I and many other clinicians are using. And number two, I have a feeling that the clinicians who are working with him also did not have a good understanding of how to use that. And then certainly once he unfortunately went down the pathway of self-administration, his assistant had no idea how to, and was completely unqualified to do this. So Zach, I'll throw the ball in your court, man. First of all, could you just tell us ego disruption,
Sure.
this whole thing, what role does it play in the process?
And this is something that I really struggled to define during my dissertation writing process was, how do we look at ego from a perspective of therapeutic intervention? And what are we looking to overcome in order to address those underlying issues? And I think one of the ways I've approached looking at it is what I call ego disillusionment versus ego death, because death implies that it's not coming back. And I think that that's a really big misnomer, because ego is something we all have. It goes back to Freudian psychoanalytics. We understand ego from a perspective of how it is a barrier or a protective factor for people from the outside world. So when we're looking at things like trauma or history of depression or treatment-resistant depression, we have to understand that ego has gotten to a point where it's almost insurmountable. It is there in a way that protects our own sense of self from being destroyed by the world around us. So it's that protective layer, and we want to be able to have that to have effective functioning. The problem is that when it's dysfunctional, when it's based in trauma, when it's based in phobia, when it's based in anxiety, it's not serving us a good purpose. So we're able to actually bring that layer down through the use of ketamine in order to address some of those underlying issues. And one of the things I think is so important is looking at why therapeutic intervention during ketamine infusion is so beneficial. It's beneficial because we're able to actually overcome the psyche's ability to say, nope, we're not going to deal with that. Nope, we're not going to look at that. And instead, we're able to kind of see it for what it is and redefine it in a way that is less stinging, that it's less, it's holding less of a control in our daily functioning. So in this aspect where Matthew Perry was doing this at home, where he was utilizing ketamine at unknown rates, we don't really know. He was also using Suboxone, which, can have a synergistic effect or even a deleterious effect. It can definitely really affect how ketamine works, but we don't know how much he was actually utilizing. So when I read these reports about, how there was this effect of ketamine, it's like, well, yes, but there are other things at play too. too.
Yeah.
And I think that's the thing that has been missed the most, is how those other effects may have really played the final kind of, outcome where we are now.
Yeah. Yeah. And that's a great point. And I guess my next question would be, and it's going to be a loaded question, obviously, you're going to see where I'm going with this, but
I love loaded questions, Carl.
How important is it for patients to sort of understand the process and what we're trying to achieve before we start giving ketamine? Like, should they know about ego dissolution, as you reference it?
I think that is such a big component of informed consent. When we give people drugs, even, psychiatric drugs, we want to make sure that they're aware of what the potential side effects are, what the potential outcomes could be. You may not feel right for 4 to 6 weeks. You may have a period of adjustment. We give all of that kind of informed consent to patients so that they're aware and can make decisions based off that information. Ketamine should not be any different. When we do therapy with people, we have to give them informed consent. Say, hey, we may jog loose some things that are uncomfortable. We may jog loose some things that, might pop up in your day-to-day life that have been in bed for a while. So we want to make sure that people understand why this is beneficial and when this is helpful. When we look at different therapeutic modalities, we're looking at ways to bring down those severities in order for people's daily function to improve. Ketamine can definitely be a fast track to improvement overall, but it needs to also be met with some kind of intervention to help people process through those things that are coming up. If we are jogging loose some of these old historic traumas, we don't want to just leave people with that. It's like going to therapy in the last 5 minutes, unboxing all of your worst fears from childhood, and then walking out the door and, crying in your car for an hour. We don't want to do that. But I think that if we can do it in a way that is therapeutic, that is intervening, that is kind of being able to bring down the severity, especially in the context of utilizing a facilitant like ketamine, we should have a controlled outcome, or at least a mitigated outcome, to be able to give somebody an idea of what to expect afterwards.
Yeah. Right. Have you seen, and I don't mean to put you on the spot here, but have you seen any patients in your practice who, despite sort of like getting an understanding, or you explaining what you think is going to happen with regards to ego dissolution and whatnot, that they still just kind of don't understand it, and it can end up sort of working against them?
Yeah, and I think that that's when people get really uncomfortable. That it's all of a sudden these things that have been avoided or have been, completely disregarded as, the experiences that have fulfilled their life, all of a sudden now are under the spotlight, and we have to kind of justify why these things have happened. So it can kind of work against people if they're not utilizing that therapeutic process to really understand why these things have been so, difficult for them. Take the fear of flying, it doesn't just come out of nowhere. It definitely had a genesis point. And so looking at what that genesis point was can be beneficial in overcoming that fear. Same thing with trauma. When we have those really uncomfortable experiences, or those really life-defining experiences, sometimes we don't want to look at those. And so when we put them under the spotlight like that, we want to be able to give people tools to be able to overcome those and rewrite the script a little bit on how they respond to it.
Yeah. Yeah, that's great. And the one last thing I'll ask you about that's interesting, when I looked at Matthew Perry and just looking at my own clinical experience, is it's interesting. I'm about to put out a series of videos on who fails ketamine, and one of them is actually and it's a little bit tongue in cheek. I don't want to say people fail it, but sometimes people who have extreme wealth, we have some difficulty, right? Because especially in my humble opinion, if you look at kind of the common view of the ego, like if someone's egotistical, when they have a tremendous amount of financial resources at disposal, they can kind of just blow off your treatment plan. I mean, I know you and I had one patient a few years ago who had tremendous wealth at his disposal, and just actually there's two people now that come to mind. But
I can think of a couple for sure.
Yeah, exactly. It's just very challenging because, like, we can talk to them about, hey, here's your treatment plan, here's what you need to do, and like, hey, screw you, I'm going to fly to Vegas and do whatever, and that makes it challenging. What role do you think that plays?
Of course, I'm getting a phone call here.
It's all good.
Sorry about that.
It's all good.
Turn on.
What role does that play, and is there a way to mitigate that?
It's funny. I think that that's where you have to really have good, solid, defined goals. What are we really trying to accomplish here? What are we really trying to observe or even get to the bottom of? Granted, stresses of of wealth and wealth accumulation can definitely have an effect on people. And I think that trying to redefine their identity can always be challenging. We look at personality as such a persistent part of somebody's experience that it takes an arduous amount of time in order to overcome those issues. And that's with any personality disorder, when we get to that level of personality dysfunction. When we kind of contextualize it in, I don't have the daily struggles of worrying where I'm going to eat tonight or what I'm going to eat tonight. Those challenges become very different. It reminds me of a study that I read in college or in graduate school about suicide amongst highly wealthy individuals during the 2008 financial crisis. And what it found was what we had to kind of determine what reasons to live were in the context of high achieving individuals. And something that I found really extraordinary was all of my classmates were like, well, they're rich. What problems could they possibly have? And so it kind of, there is this kind of stigma that comes around that. And so, that doesn't mean that they don't have their own struggles, that they haven't had their own issues with parental alienation or, other kind of issues from childhood that, affect that perception on life. And in the context of mental health care, there may be a lot more, kind of extraneous variables that we have to consider in making sure that they are staying compliant, and ensuring that they're just receiving the level of care that they need in order to be successful. And I think that's where, informed consent is still important. And I think that we have to be able to determine a really rigid treatment plan and not be afraid to fire patients if they're not following it.
Yeah. Yeah, great points. So, well, cool. Well, thanks, Zack. I mean, I'll give you the last word to see if there's anything else you want to say regarding the concept of, ego dissolution, ego death as it relates to Matthew Perry. Anything else we haven't covered?
Yeah, I think it's just really pointing out that ketamine has such a beneficial effect when done appropriately. And I think that that's the thing that we're seeing why these potential issues are arising is a lack of appropriate treatment strategies and following through with what we know to be true and good medicine and good treatment. Follow the advice of your doctor, ensure that we're doing this in a controlled environment. Set and setting is so crucial and important to beneficial treatment. And we want to just be able to make sure that people are safe. We don't want you to be using ketamine in your hot tub. Let's just be fair. I mean,
right.
Not a good idea. Yes, have a bath after your experience, but make sure you've come down a little bit before that.
It's just as an interesting aside. When I first heard that, it reminded me of Michael Jackson in his bedroom with propofol, and just like we're having the same discussion, right? I mean, propofol is a amazingly safe anesthetic agent when used in an emergency department or in an operating room, but in your bedroom, not so much. So
same thing with fentanyl. People we use fentanyl in a medical capacity every single day, without any complications. And when we start putting it in the hands of people on the street and with no oversight, we see the kind of the outcomes that occur.
Yeah, it's so tragic. So, my heart goes out to Matthew's family.
Absolutely.
This is horrible. But anyway, well, Zack, thank you so much. It's always great to get your perspective. If anyone would like to see you in Austin, Texas, how do they get a hold of you?
We are at meetyourmindatx.com.
Meet Your Mind ATX. I'll put the link in the show notes as well. And again, thanks so much for your time, Zack.
My pleasure, my friend. Thank you so much.
See you next time.
Take care.